just briefly about the evidence in kids, because there have been studies of ketamine in kids, and a lot of people don't realize that. There have been several case reports, and then there have been 2 studies that I want to kind of talk about for a second. The first study is IV ketamine, and this was a study that was done, one-site study, a small study that was done with 6 infusions of ketamine, and looking at depressive symptoms over time. And it was a pretty small study of about a dozen, a little bit more than a dozen kids. But what was shown that pre-treatment to post-treatment across pretty much every outcome measure, there was a significant improvement in the course of the treatment, a significant improvement in depressive symptoms. Again, this is a controlled study, and the first and only controlled study that has looked at an active comparator, which is midazolam. And it looked at midazolam because it's thought that some of the side effects with ketamine, there is this dissociative side effect that people get, and we'll talk about that in a second. But midazolam is kind of mimics some of the side effects, maybe, in adults and kids. And so that's used commonly as a control, but this was a controlled crossover study that was done in 17 kids, and you can see here that compared to the midazolam, the ketamine very early on, 1 day post-treatment, improved outcomes in terms of depressive symptoms, and no matter what measure you use to measure depression. So it's pretty impressive, pretty rapid, and as far as tolerability is concerned in this study, it was, except for 1 hour post-dose, when there is some dissociative side effects, they last not even 15 minutes. They're kind of gone after that. After the onset's quick, the offset is quick, and otherwise, besides for a slight increase in blood pressure, that goes away as well. Adults need to be monitored for at least an hour and a half after dosing. But generally, and this was ketamine, not S-ketamine, and it was tolerated very well. Interestingly, people seem to think, well, you need to dissociate to have the antidepressant side effects. That's been shown in some adult studies, but in fact, in the pediatric study, in this study, there was no association between dissociation and clinical efficacy. So that's really important to realize.